Hi, everybody. My name is Dr. Tony Rajiv Juneja. I'm a triple board certified psychiatrist. I'm also board certified in addiction medicine and integrative medicine, as well as I'm a fully trained psychoanalyst. I know the list seems rather long, but we'll get into why I felt I had to keep, getting more and more board certifications. That's a separate topic. But here today, I wanted to start shedding some light. I see a lot of people that are depressed. I see a lot of people that are anxious, unsure about what to do. And let's add in technology, which I think is on every parent's mind of how to deal with this. So if you have children, you're clearly dealing with technology at home. And addiction, of course, addiction to technology, addictions to behavior. How does this work? And that's really the question that got me most interested in really the brain and the mind. Initially, my bachelor's degree was in biology, minor in chemistry. But I wanted to know how the brain worked, and why we do what we do. And so I pursued a graduate degree in neurosciences at Northwestern. That got me certainly much closer to the brain and, the biology, the neurons that make up the brain. That's the basic cell of the brain. It's called a neuron. I even have a favorite neuron is the Purkinje fibers. They have at some point, in fact, we'll show you a picture of that. I love biology, but what I ultimately realized after finishing my master's degree in neurosciences was that the brain was not the mind. Okay, the brain is not the mind. The mind is really the software. It's a result of the brain. So think of it as the brain is the hardware, the psychology is the software, how you're making decisions, and ultimately, what much of this goes back to is our childhood. When you say, "Oh, does it all have to go?" People say, "Oh, does it always go back to your childhood?" Yes, most of our problems do go back to our childhood. There's something very powerful that we're going to get into as the weeks continue, and we focus on some of these topics called the repetition compulsion. The repetition compulsion. Now, Sigmund Freud, who was essentially kind of the father of psychoanalysis, or as people in the field will even call him Papa, but this idea that he recognized back in the late 1800s. Now, you got to think about this. This man used to go, see patients all day in the late 1800s, and then he would go and write volumes and volumes about the mind. He knew far as what his observation was that that there was more to somebody's solving somebody's problems than just the problem itself. You had to look at the history, the why. Somebody was depressed, not just to figure out the why, but where did this come from? Where does this originate from? Was the mother a depressive? Was the father a depressive? Was it a depressive home? Is this what he or she learned? Essentially, was how to be depressed? Or is this something new? Is this something that they were actually functioning well and all of a sudden now they're not functioning well? But the brain and the mind, I got very, very interested in it. And I would say, in fact, that's really where my real specialization or skill set is understanding how the mind works. Now, I think one of the big places this enters, of course, is relationships. Everybody wants to be in a happy relationship. But of course, this is much easier said than done, right? You don't ever plan on, getting into a back and forth, bantering or argumentative or this kind of behavior with your partner, spouse, what have you. But for many of us, this is the reality of what happens. We do end up in a situation where we are repeating repetition. We are repeating compulsively, repetition compulsion. We are repeating compulsively the unresolved conflicts of our past, okay? The unresolved conflicts of our past. Let me give you an example. So let's say somebody grows up in an argumentative home, for example. We were talking about that, right? Somebody grows up in a home that is argumentative, um, and their wishes actually it wasn't argumentative, right? Their wishes it was more peaceful. Um, and then who do they go and select to get involved with and have a family with? With somebody who came from actually a very argumentative, maybe even more of an argumentative home than the person A came from. Now, what do you think is going to happen between these two people, right? I mean, you can kind of see where I'm going with this. Is they're said now this isn't consciously when person A says, "Oh, I'm gonna, I want to mate with this person. I'm gonna, have a family, create a family with this person." That this is the plan. This is not the plan, right? Is to be in an argumentative day in, day out scenario. But when you look at it, that's what's in the blueprint. Okay. That's what's in the blueprint. So now I have 5 kids. Okay. So I got very interested in intergenerational transmission of trauma. Let me say that again, a little slower. Intergenerational, so generation to generational transition of trauma. How does this work? How do we end up with, passing our problems out onto the kids into their life cycle, right? And how to decrease, how to turn that volume down. That's really what I wanted to do is because I didn't want to pass on my problems to my children, right? So one of the things, again, you have to go back and look to is yourself, right? I'm working with somebody whose spouse thinks it's all their fault. This has nothing to do with, the one person, and only she could fix herself. You're wrong. You're doing this all wrong. I'm doing everything correctly. Now, let's try to wake up and smell the coffee here, okay? Let me just say this straight out. Every relationship, I don't care which relationship, every relationship, parental, spousal, your boyfriend, girlfriend, et cetera, friendships, doesn't matter. Every relationships involves 2 people. Every one of them you have something to do with, okay? And if anything, if you're in a root situation where you say, "I'm miserable, I wish I wasn't here," well, then you gotta ask yourself, "Why are you there?" And I'll tell you why you're there. You're there because it feels comfortable. You're there because it feels familiar, even if it doesn't feel good on an emotional level, it feels very familiar. It's what you know. So if you grew up in an argumentative home, that's what you know. That's what's going to feel comfortable for you, even though you don't enjoy being argumentative with somebody. All right. So that's just a small example of repetition compulsion. Repetition compulsion. And here's the irony of it all, folks. Okay. You know what the irony is? Is that the mind is going to recreate this unconsciously. You're not even gonna realize you're doing it. This is how many, I'd say most individuals end up you may end up married to somebody, and you'll really ask yourself, "How did I get here?" Reminds me of that, at least for the older folks in the audience, reminds me of that Talking Head song, you know? You wake up, so, "How did I get here?" "How did I get here?" And this is really what my, I guess, question or inquiry was. How did I get here? And I have a pretty good idea of now how I got here, meaning in my own life, in my own results, in my marriage. How did I got here? No, it was all by choices that I made. So there's no sense in saying, oh, it's well, she doesn't do that good enough. She doesn't do that good enough. Well, you know what? I didn't have to choose her. I could have chose somebody else, but I did choose somebody else, right? Now, this doesn't negate the good that somebody brings to a relationship, but it certainly also brings the, I guess, for lack of better words, the baggage. We all got baggage, all right? And the baggage is that intergenerational transmission of trauma stuff I'm talking about. In psychoanalysis or in the psychoanalytic world, there's even a word for it. We call it the errand. The errand my parent gave me, like my uncle. I'll give you an example. I love my 93-year-old uncle. He's the patriarch of the family. He had said to me when I was a young boy, maybe like 9 or 10 years old, that I had to erase the lines of the past of my father. That somehow it was my responsibility to uh, to undo what he had done in kind of this open context statement. Now, to a 9-year-old, boy, what that ultimately means is somehow, you know, uh, something wasn't good enough here, and I have to become that, or I have to fix that. At least that's how I interpreted it, right? And so now going back to why do I have so many board certifications? Well, for a good part of my good part of my life, really my adult life, I never felt it was enough. I had to get another board certification. I had to get another, zero behind my annual income. I had to get that next car. I had to get that watch. I had to do this. I had to do that. I had to get things perfect. But of course, that doesn't exist, right? There's always something that could be different. There's always something that could be shifted or changed. Um, so, perfection is right in the eye of the beholder. So, it reminds me of this old saying, something to the effect of, when you change the way you look at things, what you look at changes. Right? Let me say it again. When you change the way you look at things, this is Wayne Dyer actually. When you change the way you look at things, what you look at changes, right? So I got very interested in positive psychology, trying to keep on the positive side, right? But ultimately, you know what I've realized? If you look at the universe, I'm also very interested in metaphysics. If you look at the universe, the expanding universe, right? The universe is expanding. If you look at an atom, one atom, let's say hydrogen, for example, is the first element on the periodic chart of elements, right? If you look at hydrogen, it has one proton, one neutron, and one electron, right? The electron is orbiting around the proton and the neutron in the center. Now, the proton is positively charged, the neutron is neutral, and the electron is negatively charged. So it's a -1 on the electron, a +1 on the proton, and the neutron is neutral. Okay. You're with me so far, right? Now, here's something really interesting. The proton is 2,000 times heavier than the electron. Now, that is really interesting, right? It's 2,000 times heavier. Um, and most people are stuck where? Most people are stuck in their negative thoughts, right? In fact, there was a study, I believe Harvard did it. I can pull up the reference. Not right now, sometime later, but I can get it to you. But that most people have negative thoughts a majority of the day. I'm not talking 59%. I'm talking like 80, 90% of the day. That most of our what kind of the monkey on our back is are some type of a negative thought. For me, it's not enough. This is not enough. Just that thought always kind of being in my mind. And now I have to again, you know, you can't you can't heal an abscess without what? In order to heal an abscess, you have to I&D, incision and drainage, right? We got to cut it open. We got to drain it. The only way we can heal trauma is you gotta go back. You gotta understand it. You have to understand why what happened happened. It also reminds me of this idea of forgiveness. People kinda have the whole forgiveness thing. They don't really understand that forgiveness is not as simple as saying something like, "I'm sorry I forgot the milk," right? Maybe, well, it is, I mean, that's a minor example. If it happens once in a while, your spouse says, "Oh, whatever." But if it happens all the time, right? If you're saying sorry to your spouse, like, "Oh, I'm sorry, I forgot, I forgot, I forgot," and now it's the 17th thing you've forgotten, or maybe the 700th thing you've forgotten. Well, now it's a problem in your relationship, right? You have to ask yourself why you forgot. But getting back to forgiveness, so yes, you can say, "Honey, I'm sorry I forgot to grab the milk. You told me yes, I told you I'd grab the milk, but here I am. I pulled in, it pulled into the garage without the milk. So something was going on, right? So one is we need to say I'm sorry, right? I'm sorry for what? Number two, I'm sorry I forgot the milk. But that's where most people stop, okay? Now you got to do number three and four, okay? Number three here is going to be why what happened happened. If you really want forgiveness, you have to help that person understand why what happened happened, right? This morning when I thought about it, and this morning when I was leaving, I was hoping that you were going to make me coffee. I know you were, busy with, X, Y, and Z, but I was a little bit disappointed. And I'm wondering, that's what's coming to my mind. I wonder if that's related. Now, maybe it is, maybe it isn't, but there's a why. And now this person has some appreciation that you're trying to understand. You're trying to help them understand why what happened. And the fourth step, okay, the fourth step is going to to be about how you're going to make this up. How am I going to make it up to you? How am I going to make this up to you? right? How am I going to make it up to you that I did that? Okay, I can go get the milk right now. But again, if it's a chronic problem, and like I gave you, if the 700th time, I think it's going to take some serious work there, right? Because then it's a lot of broken agreements. Remember, ultimately, as human beings, all we have is our word, right? And there's nothing that will build a relationship faster or break down a relationship faster than keeping your word or not keeping your word, right? And if you break your agreements with people, you're going to see real quick that's not going to work so great. That's not going to work out so well for you. Okay, so um, forgiveness, right? I'm sorry for what, why what happened, and how I'm going to make it up to you, right? The other thing that's coming to my mind I think is worth mentioning is intentions equals results, because I want to give you something here that you can use on a daily. If you said you were going to go to the gym and then you didn't go to the gym, well, intentions equals results, right? If that's the formula, the results are you didn't go. So your intention had to be you didn't want to go, because guess what? You didn't go, right? If you knew, like, and then you will be amazed at how many people I know it was my intention to go to the gym. No, I really meant to get the milk. Well, no. Well, guess what? There was another part of you that didn't want to go work out or didn't want to go get the milk. All right. So this isn't just a well, I'll tell you now. I won't say what it isn't. I'll tell you what it is, right? What it is a great a little formula to catch yourself out of alignment. And when you're out of alignment, ask yourself why. I said I was going to go to the gym. I didn't go. I said I was going to start taking my fish oils. I didn't start yet. Why? Why? You know, it reminds me of the fish oil question is me, really. Like, why didn't I take and there's a wish that somebody else would have given them to me. Probably goes back to the wish I was talking about with my wife, that somebody else would have given them to me. Now I can keep wishing and waiting, but guess what? Fish oils didn't get into my body today, right? Anti-inflammatory. We'll talk about integrative medicine in the future in much more detail. But um, so who's really at kind of who's not getting the benefit? Well, that would be me. I'm not getting what I really wanted, right? Which is to be healthier, live a longer life, and so on, right? So or I could keep hanging on to the wish, or maybe my wife will get that for me. But if, I keep waiting and keep waiting and keep waiting, and maybe she does. On some days she does. But again, if you want to fix the problem, you got to understand what's happening underneath it. A good way to catch yourself is intentions equals results, right? And when that's in alignment, give yourself a pat on the back. I said I was going to work out. I worked out at 6:30 a.m. That's my Tuesday, Thursday schedule, 6:30 in the morning, and I built in a way to make sure that happens. And, if I need support, I need support. If I don't need support, that's great. There are people that can, work out at, in the early morning without support. I like to work out with a workout partner. That way I know I have a commitment there and it works at a much higher success rate, right? So that's really the goal is I want you to be able to live a happier life. Now I say happier because that happiness is another word I think is really kind of thrown around without much thought given to it. Because if you really think about it, I can, tell you things I'm happy about right now, and I can tell you things that I'm not happy about right now simultaneously. Okay. This isn't that happiness exists in a vacuum and that this is just going to be all about happiness. It's really that there are things that I'm happy about. There are things I'm not happy about, So, this generic answer, how you doing? I'm fine. I'm fine. Yeah, I'm good. I'm fine. But that's kind of, I guess that's just a nice formality of when you're greeting somebody, because really, if you start digging, there's a lot going on, right? It's like the person who tells me they have the perfect childhood. All right, I tell them, listen, I don't know if you want to spend an hour with me because I might help. You might see things that weren't so perfect, And it's not that I'm trying to burst anybody's bubble, but the reality that that I had a perfect childhood. Well, that's a fantasy. Nobody has a perfect childhood. Everybody has a difficult childhood. It wasn't easy being a child. It wasn't being easy being an adolescent. It's not easy at all. And in fact, life isn't easy. And my goal here is to try to help you figure out the why so you can make your life better. so you can make decisions that ultimately have you living a happier life, not necessarily a happy life, a happier life. Pain will come. Pain will definitely come. And I love all 5 of my kids, and I used to think that having children was a necessity, and that if you didn't have kids, something was wrong. But you know what I've realized? That's not true at all. That's not accurate at all. Um, why? Because ultimately, you know what? Having children, again, it's a great joy, but it also brings you a lot of pain. Why? Because you have to grow. You have to put themselves in front of your own needs. You have to make decisions for them that are in their best interest, not in your best interest, right? How many people would not even be in the marriage they're in if they weren't thinking about the kids, right? A lot of people, right, that's a majority, I'd say, that I speak to. We want to try to work it out for the kids. We want to try to work it out. Um, so I tell people this: listen, if you're going to stay, you got to accept your partner. If you're going to go, same goal, except you want to accept your partner because you're in it now for the long run. You have a child together. It's going to take some time and to get that child, to the adult state. And nowadays, I know technically people become adults at 18, but please, that's almost a joke. You know how many kids are living at home until well into their 20s now, if not even early 30s. And that's okay to live at home. But my point is that life is hard. Life is really hard, and my goal here is to make your life a little bit easier. I'm going to wrap up this segment of the show. Thank you today for joining me. This is Dr. Raj. And, you can always send in your questions. If you call, you can leave a message with your questions at 818-259-2620. Again, that's 818-259-2620. That's my California location. And there will be a voicemail set up there for you to leave your questions. And so I can educate you on your questions. All right. Thank you very much and have a great day.